I'm going to talk about an important nerve in the lower back, which is called as sinovertebral nerve. The sinovertebral nerve governs the periphery of the intervertebral disc. Even though we call disc as aneural and avascular, the periphery of the disc, especially the annular fibers, they are innervated by this sinovertebral nerve from the posterior aspect as much as towards the anterior aspect of the ring of the annulus fibers. Given that majority of the people in the world are having discogenic pain, almost 60 to 70% of the back pains are attributed to the discogenic pain. Which nerve carries the impulse from the disc? It is this nerve, and this nerve is in fact a part of a exiting nerve. I mean a spinal nerve as it exits from the intervertebral foramen. For example, here if it is a L4, L5 disc, the L4 nerve will exit in the intervertebral foramen, and as it exits, a branch will originate from this spinal nerve, the ventral rami, and becomes a sinovertebral nerve that innervates the periphery of the disc, and it also has a sympathetic connection. That's why whenever the disc is injured, let's say there's an annular tear, you won't see that small tears in the MRI. That's why some MRIs are absolutely normal, yet the patient will be having discogenic pain or even some cases sciatica pain. It's because the disc which is disrupted here, let's say there's a small annular tear here, and that tear will not be shown as a visible herniation in the MRI, but the chemicals which are leaked out of the annular tear can inflame the nerve which is safeguarding the disc. So this sinovertebral nerve will pick it as a threatening impulse, and then that will connect the messages to the exiting spinal nerve, and the messages which goes up to the brain will be corresponding to the dermatome of this L4 nerve. So the human brain will not know the pain is actually coming from the disc, rather the pain will be represented in the form of L4 nerve, because the sinovertebral nerve joins the L4 nerve and the brain cannot discriminate where the impulse is coming from, so the pain will be referring. That's why 100% of the pain in discogenic pain is always a referred pain. That means the locality where it pains is a wrong locality. The source is actually coming from the sinovertebral nerve which is innervating the disc. That's why no matter whatever you do for the treatment at the locality, the pain does not even change, because the treatment must be aimed at the disc level. Let's say there's a posterolateral bulge here. Some bulges will escape the radar of sinovertebral nerve and directly compress the exiting nerve. So we call that as lateral bulge or far lateral disc bulge, wherein directly it touches the exiting nerve and that causes classical sciatica type of pain. So this is one variety of it. But when the discogenic pains in the beginning days, it will be more of central pain, it will be more of spasms, it will be more of tightness, but those are all referred sensations and referred pains, which the patient oftentimes get confused as gastric catch or muscle spasm and so on. Injury at the disc level causing irritation of the sinovertebral nerve is one of the pain generator of the back pain. Apart from that, there are other pain generators which can be coming from the dural sheath irritation, which can be coming from the nerve compression, as in case of classic radiculopathy. It could be coming from the facet joint arthritis, which is again one more reason for the back pain. So when it comes to low back pain, it's our onus to identify the pain generator, where the pain is coming from. That if it is identified, the treatment becomes easy. So the pain generator in the low back pain can be discogenic in nature. So don't go by the locality of the pain or the characteristics of the pain. Identify the patterns. If the pattern recognition is done correctly, then you will be able to precisely diagnose the condition. So start diagnosing the back pain. You will be probably getting better outcomes.